The radial nerve. The radial nerve is the largest branch of the posterior cord of the brachial plexus with a root value of C5 to C8 and T1. Origin, course, and termination of the radial nerve. The radial nerve runs behind the third part of the axillary artery. So this is the radial nerve and this is the in the arm. It lies behind the brachial artery. It leaves the brachial artery to enter the lower triangular space to reach the oblique radial sulcus on the back of the humerus. The nerve reaches the lateral side of the arm 5 cm below the deltoid tuberosity. It pierces the lateral intermuscular septum to enter the anterior compartment of the arm on the lateral aspect. The radial nerve then descends down medial to the lateral epicondyle into the cubital fossa. The radial nerve terminates by dividing into the deep branch and the superficial branch. The deep branch is also called as the posterior interosseous nerve. So this is the deep branch and this is the superficial branch of the radial nerve. Relations of the radial nerve. In the lower part of the axilla, the radial nerve passes downwards and has the following relations. Anteriorly to the third part of the axillary artery, posteriorly to the subscapularis, the latissimus dorsi, and the teres major muscle, laterally to the axillary nerve and to the coracobrachialis muscle, medially to the axillary vein. In the upper part, it continues behind the brachial artery, passes posterolaterally through the lower triangular space between the teres major and the long head of the triceps brachii. It then enters the radial groove with the profunda vessels. So this is the teres major and the long head of the triceps muscle. In the radial groove, the nerve runs downwards and laterally between the lateral and the medial head of the triceps muscle. At the lower end of the groove, 5 cm below the deltoid tuberosity, the nerve pierces the lateral intermuscular septum and passes into the anterior compartment of the arm to reach the cubital fossa. Cutaneous branches. In the axilla, the radial nerve gives off the posterior cutaneous nerve of the arm, which supplies the skin on the back of the arm. So this region is supplied by the posterior cutaneous nerve of the arm. In the radial groove, the radial nerve gives off the lateral cutaneous nerve of the arm. So this region is supplied by the lateral cutaneous nerve. Branches. The deep terminal branch enters the back of the forearm by passing through the supinator muscle. The superficial terminal branch is closely related to the radial artery in the middle 1/3 of the forearm and it is purely cutaneous. In the lower 1/3, it reaches the anatomical snuff box where it is distributed to the lateral half of the dorsum of the hand and to the proximal parts of the dorsal surfaces of the thumb, the index finger, and the lateral half of the middle finger. Injury to this branch results in small area of sensory loss over the root of the thumb. Clinical anatomy of the radial nerve. The radial nerve is very commonly damaged in the region of the radial groove. The common cause of injury are as follows. Sleeping in an armchair with the limb hanging by the side of the chair, also called as Saturday night palsy, or even the pressure of the crutch called as crutch paralysis. Fracture of the shaft of the humerus results in weakness and loss of power of extension at the wrist. This is known as wrist drop, and sensory loss over a narrow strip on the back of the forearm and the lateral side of the dorsum of the hand. Wrist drop is quite disabling because the patient cannot grip any object firmly in the hand without synergistic action of the extensors.